Okay, let's move on to Twitter. We've been talking a lot about the content moderation policies over at Twitter and why they matter. And I'll put that at the very top, which is that Twitter is where the elites have discussions. That matters a lot because those discussions filter down through different cable news mediums, radio, and elsewhere to you. So even though you may not be on Twitter, you are very influenced by Twitter. Politicians are always there. The doctors even are always there. The public health people. Everybody's debating and talking. It's a medium of discussion. So when that medium has policies which hurt journalism, it has a disproportionate impact on the entire field. When that medium has a disproportionate impact in its censorship policy, it will affect what you see and what you don't in many other cases. So let's put that at the top. And that's why this new censorship policy matters a lot. Let's put it up there on the screen, please. Twitter is going to penalize users who claim that vaccinated people can spread COVID-19. So I'm going to read directly from the new section on their website. Quote, when tweets include misleading information about COVID-19, we may place a label on those tweets that includes corrective information about that claim. We may apply labels to tweets that contain, for example, false or misleading claims that people who have received the vaccine can spread or shed the virus to unvaccinated people. Users can receive penalties up to and including a permanent ban. So that change was made on December 2nd, 2021. This matters a lot because it actually directly contradicts the CDC's previous announcement and guidance prior to the month or to the day of December 2nd. That's our second thing. Put that up there on the screen, please, where you can see here directly. CDC Director Rochelle Walensky. Now, this statement, July 30th, 2021, quote, high viral loads suggest an increased risk of transmission and raise concern that unlike with other variants, vaccinated people infected with Delta can transmit the virus. Now, I'm not saying that vaccinated people are the only people who can transmit the virus. I'm not making claims like that whatsoever. But we also, Krystal, have some new data out this morning that because of the way that populations are dramatically more vaccinated than not, that we do see quite a bit of Omicron spread amongst the vaccinated. I'm doing my monologue today. One of the things I'm mentioning is at Cornell University, a place where they have a hard vaccine mandate for all employees and students, has seen some 600 cases of Omicron breakout. That is actually nothing that much to worry about. If you're vaccinated, your chance of hospitalization and death is dramatically reduced. Yes, you will get a cold, essentially, or a mild case of the flu. That's basically what happened to me after I got COVID and I was vaccinated. But the irresponsibility of this moderation policy is that it is directly contradictory, not only, of general scientific consensus, but even from the most, out there people at the CDC.
Yeah. And
they see no problem with that. It's outrageous.
The whole case for people getting boosters right now is because now, there's a big concerted effort from the federal government for people, not just the elderly, but all adults to go out and get their third shot, is because not that if you're vaccinated, you should be worried about severe hospitalization and death, but because you want to have a booster so you can further limit the spread. That indicates that if you are vaccinated, you can still spread COVID.
Right.
Now, listen, what a lot of anti-vaxxers do is they will conflate the fact that you can spread COVID if you're vaccinated with the idea that you are just as likely to spread COVID if you're vaccinated as not. That claim is false. And if that claim, that could be fact-checked or whatever. But to go directly against the science here, what the CDC says, which is that especially with Omicron, I just read a New York Times article this morning about how it is likely there will be more breakthrough infections with Omicron among the vaccinated, and that will, if you have vulnerable people around you, that's something you should be concerned about because you can, in fact, spread it. Again, if you're vaccinated, and especially if you have your booster, you are less likely to spread COVID, but you can still spread it. And so what their official policy is directly anti-science. I mean, there's just no other way to possibly read it. And the reason that this is also important is because something that we've been pointing to, and many others as well, is that the people at Twitter, they're not scientists. They're not public health officials.
Yes.
The people at Facebook, the people on YouTube, they're not public health officials or scientists or experts. And you're putting this tremendous power into their hands to deem what's true and what's false on coronavirus and every other medical issue when sometimes the science is unclear.
It's complicated.
There's oftentimes debates among scientists about what the right course is and what we're seeing in the data, and there are different studies that can be contradictory. So the idea that they're going to be able to sort that out effectively, obviously this type of guidance very clearly demonstrates that they are not in a good position to be able to be effective moderators of what the truth is in science.
No, absolutely. And even, trying to figure out what that less likely figure is on vaccination is pretty hard. I was just trying to find, I know there's a Lancet study which looked into this. There's not really a hard number in terms of what that is. It also changes depending on Alpha variant, Delta variant, and Omicron variant around the exact, how likely you are to spread it, even if you are vaccinated. And once again, look, the core case to me is hospitalization and death, especially in the elderly and in the obese. If you have any sort of comorbidity or if you're elderly, then a case of COVID can be a real problem for you. At very least, it can severely hurt your immune system. I can tell you of a personal experience. My 90-year-old grandmother got COVID and was in the hospital in India. She survived thanks to the vaccine, or at least what I suspect to be the vaccine.
Wow.
It's pretty amazing. If you're in your 90s, previously that was probably a death sentence. But that doesn't mean that she hasn't had some reduced impact on her immune system. So I just think that it's important for people to keep that in mind, and especially to look at that, especially when we're talking booster policy. But beyond that, the point is that it's a rapidly changing situation. Putting in moderation standards like this and exposing people to permanent bans for claims which are outright true just goes to show that these people are not interested in science. They are not interested even necessarily in robust debate. They are willing to err on the side of what they think is the morally just position. And maybe you can think that, but it does not matter. What matters is that we actually have the ability to talk honestly. Something that we'll be covering in a future show, but which I just literally saw this morning, Krystal, is that the White House has been holding, quote, information sessions with Twitter influencers who are doctors. So they are literally, the Surgeon General of the United States is trying to get influential doctors on Twitter to kind of parrot the party line of the White House. And I'm looking at this, I'm like, this is crazy. We have the White House, which has been wrong in many cases around science. Joe Biden, our president of the United States, who's a boosted man, still requires masks indoors in his building. Look, maybe, okay, maybe that's fine.
He's pretty old.
He's old as hell, but that's not necessarily a very inspiring thing to watch and say like, hey, how come the White House has a mask mandate when the District of Columbia, the city that we live in, doesn't even have one? They don't have an answer to that question. They're just paranoid. So they go far beyond what the science calls for all the time. That's their right. They can do what they wish. But the problem is that then they're the people setting national policy. They're also the ones who are influencing this type of discussion, our discourse, all of that. And that is what really, sets me aflame when I look at
isn't that
this
sort of standard, operating procedure for White Houses, though? Obama did it, Trump did this sort of stuff, too,
yes.
Bringing in conservative influencers and news
I would
people.
posit that conservative influencers have far less influence than the Twitter doctors.
I totally disagree with that.
I
totally
Krystal.
disagree with that. There is a very effective right-wing pipeline that does not exist.
Certainly true.
Certainly on the left, liberals obviously have a lot of cultural power and institutions.
On socio-cultural issues, I would say yes. On COVID and how it's going to impact blue policy. Look, I can tell you that I know for a fact that these, the DC mayor and the local COVID officials in Santa Barbara or wherever, California, they are heavily impacted by what these blue checks on Twitter are saying. And some of these people are freaking crazy. We're talking about, I see folks out there who are like mask forever.
Yeah, I just think because it's so tribal that you have one group that's very influenced by that, and you have another group that's very influenced by, what Ben Shapiro or whoever is
Absolutely.
saying.
I'm speaking only in a public health context, not in, it is standard operating procedure, absolutely. I just think these people have a very outsized impact on how it could come and affect all of our lives, which is bothersome And it seems to see that how much influence they have and direction from the top can also be an issue. But I mean, the major point to me is it's very clear that this policy is far beyond what science is. Who knows how this segment will do? I have no idea. I'm very curious to see how YouTube treats it.
Indeed. Hey guys, thanks so much for watching.
That's right. Just as a reminder, you can become a premium subscriber today. Watch the full show completely uncut, our reactions to each other's monologues. You get to listen to it. You get to ask us questions, all that good stuff. Link is right there in the description or at breakingpoints.com.
Best of all, great way to say screw you to the mainstream media.